Hi doctors, this video is to help you prepare for the OET Medicine speaking test. I'm going to explain how to approach a speaking role play, make the most of your preparation time, demonstrate the assessment criteria in your speaking, practice the role play, and learn from each role play you complete. Ready? Let's go. The medicine speaking test requires you to role-play two different situations with an interlocutor. You will always take the role of the doctor in the conversation, while the interlocutor will take the role of your patient or a family member of the patient. For example, their husband or wife, adult son or daughter, or the parent of a young patient. The two role-play situations will be quite different to allow you to demonstrate a range of English expressions and functions, which are typical for healthcare conversations, including reassuring, explaining, persuading, and asking questions. The interlocutor, as the patient or family member, might also have an emotional response to their health condition, such as anxiety, frustration, or sadness, which are all common emotions doctors deal with every day, and allow you to demonstrate your empathy and ability to manage the patient to make the right choices and decisions for their health. Everything that you learn while preparing for OET speaking will be immediately useful to you when starting your new healthcare role in an English-speaking environment, and give you the confidence to tackle any situation, from giving bad news to explaining the steps of a healthcare treatment. By demonstrating flexible, accurate English and responding appropriately to the interlocutor, you will demonstrate to the assessor and regulators that you have the language required for a B grade or higher. Before each role play, you have 3 minutes to prepare for the conversation using the role card. Remember that you can ask the interlocutor questions during the preparation time. I need to demonstrate that I am taking their situation seriously and have some advice to help them. I should aim to move through tasks 1 and 2 fairly quickly. The OET speaking test is unique in that it simulates the real-life conversations you have with your patients as a doctor. It's important to remember this once the role play starts because it will help you to communicate naturally and effectively with the interlocutor as your patient. Here are a few tips to speaking clearly and demonstrating the assessment criteria. Get the role play off to a good start. You are expected to start the conversation as you would in real life. Make use of the information you picked out in the preparation time to start the role play appropriately for this situation. I know this patient is feeling unwell, tired, but busy, and I have a lot of things to talk through with them. So during the preparation time, I ask the interlocutor what name I should use for them, so I don't need to do introductions, and start. Hello Jenny, what can I do for you today? This isn't the only option for starting the role play. I could complete introductions as if this is the first meeting with the patient, but if I do this, it will need to be brief so I can move straight into the tasks. Take time to listen to the patient and respond to what they tell you. The role card gives you a lot of information about the conversation, but you cannot know exactly what the patient will say in reply to your suggestions and advice. So make sure you are fully listening to what they tell you. Don't use this time to think about what you are going to say next, or you could miss something important. Show the patient you have listened by responding with something appropriate. For example, they may tell you they are concerned about what a diagnosis of diabetes might mean for their health and current lifestyle. Show you have listened by commenting on what they have just said. It's quite natural to feel anxious about the possibility of having diabetes, but it's not yet confirmed, so let's wait until we know for certain. Be authentic in your role as a doctor. Sometimes you will need to be firm and tell the patient that what they are asking is not good health advice. Or at other times you will need to clearly explain a process the patient is unfamiliar with. Do what you need to and make sure you match the tone of your voice to what you are saying. In this task, you need to provide clear information and persuade the patient to make lifestyle changes. To do this, make your voice sound kind, but use firm vocabulary choices and don't speak too fast. It will take a while to adjust to these changes, but it is the best thing for your health and to avoid further complications. Remember that this situation is new for your patient. Many people are fortunate to have good health for most of their lives, and on the occasions they do need to seek medical support, they feel vulnerable and anxious because they do not know why they are feeling this way or how the problem might be resolved. Although you might have talked about lifestyle changes many times before, this patient is feeling unwell and concerned that they might have diabetes. Try to put yourself in the patient's shoes and think about what you would want to know about the condition if this was the first time you were discussing it. There are a number of ways you can practice the role play with a family member, a friend, or a colleague. It is important that you only look at the doctor's card before you practice, so that you are only getting the same amount of information that you do in the test. If you print off the role cards, tear or fold the page in half so you only have your card, or if you are looking at the task online, change the size of the card so you can only see your part. Ask your patient to play their role fairly. If the task says they are worried, they should use language to show this. If it says they are frustrated, then similarly they should use language to show this. OET roleplays will never use extreme emotions like anger or tears, but it will help you prepare if you feel that slight pressure which comes from facing a patient who is feeling negative and trying to help them. Record the conversation on your phone so you can listen back to yourself afterwards. You can also use your phone as a timer to alert you when 5 minutes is complete. If you turn your phone face down in front of you, it will still be able to record while you will not be tempted to keep checking how much time is left, which is something you cannot do in the test. At the end of the role play, ask the friend or colleague who took the role of the patient how they felt during and after the conversation. Did they feel informed and supported during the conversation? Or was anything confusing, leaving them uncertain and with questions at the end? Consider this feedback and how you can improve on this for next time. OET blog available on our website.